Good morning. My name is Toni Codispoti. I'm here as a concerned caregiver. My husband was first diagnosed in 2000 with colon cancer stage 2. It reoccurred in 2001 with mets to the liver, making it stage 4. We are still battling this chronic disease. The issue today is equitable accessibility to Avastin and other drugs. I would like to start with a quote from Mr. Smitherman to the Economic Club of Toronto on September the 11th, 2006, re Bill 8, the commitment to the future of Medicare. Quote, "The legislation reflects our belief that the health system must be patient-centered, accountable, and respond to assessed need, not a person's ability to pay. It closed legislative loopholes that allowed queue jumping and extra billing, and made two-tier health care illegal in Ontario. There are many patients who are paying or will be paying for the drug who could not be here today. What you will hear now is the reality. To talk about the reality are John Colaci, Wendy Mundell, and Joachim Teotonio. Then I'll share my recent experience. Okay, John, would you like to start?
Thank you. I'm a 42-year-old, happily married, with 3 children, ages 5 to 11. On March 30th of this year, I was diagnosed with a reoccurrence of metastatic colon cancer. I was informed by my doctor of a first-line cancer drug that is currently recommended for my disease. However, it is currently not funded in Ontario. This is a drug that Cancer Care Ontario recommends as a standard therapy for metastatic colon cancer. I am facing a situation where paying for the drug out of my own pocket will be the only way of acquiring this treatment. It will cost my family $36,000 payable to my local hospital, the Trillium Health Center. This cost is causing a great deal of concern for my family's financial future. I am hoping that the provincial government will fund my cancer treatment. In fact, I am praying that some other solution will present itself. A couple of years ago, I never thought I would be in the situation I am in now, appealing to my provincial government for help in my battle with this serious illness known as cancer. My greatest hero is Terry Fox. One thing about Terry Fox is he always stood up for things he believed in. If I lived in British Columbia and was being treated for cancer there, I would not have to pay for my cancer treatment because it is funded by the province of British Columbia. I was born in Ontario. I have lived my whole life in Ontario. The beacon has been lit. I expect more from this Ontario government, not just for me, but for every other Ontarian that could encounter this problem. I appreciate this opportunity to express my views and beliefs. Thank you.
In January 2006, I was diagnosed with advanced stage 4 colon cancer at the age of 40. That day in January changed the rest of my life. No longer was my job in the career of my choice, but one of trying to navigate our healthcare system. It became clear to me that early on that the drugs I needed to fight my cancer were not being provided by my universal healthcare system that I, as a Canadian, had been taught to be so proud of. I'm a Canadian first and foremost. I happen to live in Ontario. Who would have thought that this would affect the type of treatment that was to be available to me? Prior to my diagnosis of colon cancer, I had never been treated for an illness or undergone any surgery except for the extraction of my wisdom teeth. I was denied the access to colonoscopy because I did not match the profile for colon cancer, although I asked for a number of times. Who then should be accountable for me being diagnosed with advanced stage colon cancer at the age of 40? I was denied the recommended standard in screening, and now I'm being denied Cancer Care Ontario's recommended standard therapy for my disease. The prognosis of a stage 4 colon cancer patient is not promising. It definitely will not improve if we do not utilize the latest drugs that have been proven to increase the length of survival. I strongly feel this is a moral issue. How does the government of Ontario have the audacity to make the choices that deny their citizens the recommended standard of care that is offered in other G8 countries? As cancer patients fighting our disease, it is hard enough without also having to find ways to fund the drugs that's recommended for our care. Our families and friends should not be burdened by our need for these drugs. Last year I was billed a total of $18,000 for Avastin, and only after I incurred the cost myself, I received some assistance from my third-party benefit package. Avastin afforded me a second chance at survival, as it allowed me to have an operation to remove the cancer from my liver. Why doesn't this government agree that my life is worth $18,000?
In October 2006, I was diagnosed with colon cancer. After successful surgery in November 2006 to remove the tumor, I was referred to the Trillium Health Center Oncology Clinic in December. That I used so far was okay. It got me through surgery, got me to that point. After further testing, it was determined that I was positive metastases to my lymph nodes and possibly my liver. In February 2007, my oncologist prescribed Avastin for my treatment. He informed me that Avastin, a Health Canada approved drug, was recommended by Cancer Care Ontario as a standard therapy for my disease. He indicated this critical drug, however, was not covered by OHIP. He stated that the hospital was prepared to absorb the cost of injection of the drug as part of my overall chemotherapy, but that I would be responsible to pay the $2,637.50 cost per injection for the drug, if I wanted it included. I needed 12 injections of this drug. I must say I was stunned at the prospect of a $32,000 personal expenditure for an approved drug to be administered in a hospital. I guess this health car was not really all that good after all. What I really needed was this, my Visa card. I have with me receipts for 4 payments to the Trillium Health Center, each in the amount of $2,637 for my drug injections so far, all on Visa, and also a bill for a private infusion clinic, which was another avenue that I explored early on in my treatment. This two-tier health care, I'm paying for hospital injection of a medically necessary drug. That is in direct violation of the Canada Health Act, as it states that drugs administered in hospital are to be covered by our health care providers and systems of the province. We have asked the federal government, which has the legal responsibility to intervene and give clear instruction to the government of Ontario that hospital-based cancer drugs are covered by the Canada Health Act and patients not be charged. The government of Ontario has collected well over $2.5 billion in health care premiums. So why are we not getting the prescribed drugs that the law prescribes they should be paying for? 40 years ago, I had the pleasure of going to Expo 67. For those of you old enough to remember, there was a wonderful pavilion there that Ontario had. It was magnificent. It featured a movie called A Place to Stand with a wonderful song. And you all know it. It went, and we built Ontario, a place to stand and a place to grow, Ontario. Well, ladies and gentlemen, I'm sorry to say that Ontario for cancer patients is now a place to die if you can't afford the cost of the drugs. Thank you.
Okay.